There are only 4 kinds of people in the world: those that have been caregivers, those that are caregivers, those who will be caregivers, and those who will need caregivers. Former First Lady Rosalind Carter.
Caregiving means a whole bunch of things. It means responsibility, but it also means joy. It means a tie to doing things that you feel is helping somebody else because you want to, and because it's reciprocal. That person is receiving care, but they're also giving care just as you are. So it's about interdependence too, that we are in this world together as humans.
What family caregiving means to me. Taking care of my dad as he's getting older, figuring out what he needs help with and the best way to give him the help so he doesn't feel like he's helpless. Coordinating the roles of other people so that we get everything done that needs to be done.
I would have to say that now that I am at the end of my caregiving journey, both my parents are now deceased, I would say the words that sum it up the best are joyous exhaustion.
Currently in Wisconsin, hospitals are not required to ask a patient if they want a family or informal caregiver identified and named in their medical record. When caregivers are excluded from vital hospital discharge discussions, discharge planning, and training for the patient's care, there are negative health outcomes for the caregiver and possible hospital readmissions for the patient.
I have just been so astonished in the discharging planning process, how ill-equipped I felt and how out of control every situation felt. I would be handed a list of appointments because I would be expected to take somebody to appointments, but I wasn't allowed to be part of setting up the appointments. So we'd leave hospitals and there would be a series of sometimes 6 appointments that had been set up without our participation. I have a big job where I have to be present a lot of the time, lots of meetings. I was rescheduling, letting people down all the time, having to scramble to try and go to these appointments that were preset. So again, I was expected to, but I wasn't allowed to participate in.
There were 2 hospitalizations. One was just an ER visit, and the other one was where he went inpatient. And while he was inpatient, they placed a catheter. And when I went to pick him up to bring him home, where I would be the primary caregiver, I told the nurse, "So he has a catheter?" And she said, "Oh yes." We showed him how to take care of it. And I looked at her and I'm like, so he's somewhat confused, but not bad. But he also has arthritis in his fingers, wondering how he's gonna, manipulate the screw that you have to unscrew for emptying the bag. And so I'm like, okay. Now, where it's fortunate for me is I have a background of working in the medical field. So I know the resources that are available. I know how to take care of somebody. So that particular discharge, when they said, "Oh, we've gone over everything with your dad, it's all good," I thought, I'm not going to argue with her. I'm just going to pack him up and take him home because I know what I need to do. But we were given really no instruction sheets on how to take care of things. We were told when his next appointments were, one with the urologist and one with his physician. Oh, and by the way, my dad could not empty his own catheter.
My husband happened to show up at the time that they were wheeling him out to go to a facility that they hadn't told us was happening. And it's, again, not ill intent, we're an extra step. And they said, he's his own person. We said, well, how are you going to pay for that transportation? Because it was a cash transportation they had set up. He had no money. He can't manage anything like that. Where's power of attorney for finance too? So they were going to send him in a transport without cash to pay the driver. I guess we didn't know where he was going. So that was probably not a good situation. We had to follow the transport to find where he was being discharged to.
According to the National Institute on Health, the Caregiver Advise, Record, Enable, or CARE Act encourages the inclusion of family caregivers in the hospitalization process for patients. The CARE Act requires hospitals to record the name of the family caregiver on the medical record of your loved one, inform the family caregivers when their loved one is to be discharged, provide the family caregiver with education and instruction of the medical tasks he or she will need to perform for the patient at home.
In terms of being identified as a caregiver when you come into a hospital setting, sometimes checking that box needs to be more box, including us. Just, I think a really important inclusion point could just simply be whenever medical information is going to be discussed, we've already been identified. Could we just even be on the phone and know together what decisions are being made? So knowing that and knowing it's going to happen would greatly increase our confidence in what's going to happen next. We won't be surprised. We'll know what's going to happen. So identifying us clearly in the charts and making sure the information is there could be really important.
So my father has experienced several hospitalizations in the last couple of years, and each discharge is different. So as a family, we've learned what works well for us and what doesn't. Making me be the point of contact because I have experience in the social welfare field. I also have experience with medical procedures and things like that. Really made things run much more smoothly when I could be there and to actually talk to the doctor and sometimes the nurses, get the discharge paperwork in my hands, and I could follow up with things. I could read the paperwork, ask questions right there. That really makes things go much more smoothly. Putting it in the chart that it's important to always talk to me as the point of contact. That way things don't get lost in translation.
I think it would be in the hospital's best interest to develop some type of a easy to follow procedure for the nurses and the discharge planning staff, where they are able to identify who the family caregiver is, identify what exactly are the problems, and assemble the literature easily. They could put that in and the flyers would come up, they could hit print, and there they'd have the information to give to the family. So often, if families aren't made aware of what a person's medical conditions are, and they don't have good instructions from the hospital, and they take their person home and they miss something, that could have been a problem that could have really caused significant setbacks.
Ask your state legislators to support the CARE Act, which provides patients an opportunity to designate a caregiver who will receive, before the patient is discharged from the hospital, instruction regarding assistance with the patient's care after discharge. Our deep appreciation to grant makers in aging and community catalysts for providing the funding for this video through a Changing the Care Conversation grant.